In 1847, women admitted to Vienna General Hospital's maternity ward begged the nurses to turn them away. Not because of the pain, because of the doctors. Some of them chose to deliver on the street outside rather than be admitted. Those women had better odds of surviving. Vienna General Hospital had 2 maternity wards running side by side. The first ward, doctors and medical students. The second ward, midwives. The death rate in the first ward ran as high as 18 women out of every 100. The death rate in the second ward, 2 or 3. The numbers were published. The priests walked through the first ward. The women in labor knew which ward they were being admitted to. They fell to their knees and wept. For 30 years, nobody in medicine asked why. Ignaz Semmelweis arrived at Vienna General in 1846 and started asking. He watched the doctors begin their mornings in the basement, hands inside the bodies of women who had died the night before, dissecting, learning, then walking upstairs without washing and delivering living babies into living women. The midwives never went to the basement. Then his close friend Jakob Kolechka died, not in childbirth, from a scalpel nick during an autopsy. The symptoms were identical to the women dying upstairs. Semmelweis had it. He called it cadaverous particles. We call it bacterial contamination. He didn't have the language yet. Germ theory didn't exist. But he had something more dangerous than a theory. He had numbers. He introduced chlorinated lime handwashing at every entrance to the first ward, every doctor, every student, every time before touching a patient. The death rate dropped from 18% to under 2% in 2 months. In some months, it went to 0. 2 months. The same ward. The same doctors. The same hospital. He presented the data to the medical establishment of Vienna. They rejected it. Because accepting Semmelweis meant accepting something unbearable. It meant that every senior physician who had walked from the morgue to the delivery room for the past 30 years had been carrying death on his hands. That the hospital, the institution, the building designed for healing, had been the source of the killing. The pride of European medicine could not absorb that. His superior blocked his research. His colleagues published papers dismissing his findings. The most prominent obstetrician in Europe wrote that the idea of handwashing as disease prevention was beneath serious consideration. Semmelweis was removed from his position. He moved to Budapest. Kept working, kept watching women die from the same infection he had already proved how to prevent. He started writing letters. Long letters. Furious letters. He called his opponents murderers. He published open letters to the professors of obstetrics across Europe, accusing them by name of killing their patients. He was right about all of it. He was also breaking apart. In 1865, colleagues committed Semmelweis to a mental asylum in Vienna. He was 47 years old. He died 14 days later. The official cause? Septicemia. A bloodstream infection, possibly from wounds sustained during his admission, possibly from a beating. Ignaz Semmelweis died from the same category of infection he had spent 20 years trying to stop. 2 years after his death, Joseph Lister published his work on antiseptic surgery. Louis Pasteur's germ theory had already reshaped medicine. Within a decade, handwashing before delivery became standard practice across Europe. Semmelweis was vindicated. He was also in the ground. Now, what were the doctors actually doing in that delivery room? This is the part that gets left out. When a woman arrived in labor, a doctor performed an internal examination. With his hands. Hands that had frequently come from the dissection table, or from a previous patient, or from instruments that had never been cleaned. Forceps, metal instruments for extracting the baby, were used without sterilization. passed between patients. Stored in pockets. When labor was obstructed, doctors performed what they called destructive operations on the baby to extract it and save the mother. These were performed with unclean hands and unclean instruments in rooms that were never disinfected between patients. Bloodletting was still practiced on laboring women in complicated cases. These were not rogue doctors. These were the best trained physicians in the world, operating exactly as they had been trained, doing exactly what the textbooks said to do. The textbooks were killing people. The United States today has the highest maternal mortality rate of any wealthy nation on earth. It has been rising for 30 years. Black women in America die in childbirth at 3 times the rate of white women. The most common finding when researchers study these deaths is not missing technology or missing resources. It's that the women said something was wrong. And they were not believed. Semmelweis is remembered as a tragedy, a man ahead of his time, a cautionary tale about institutional resistance to new ideas. But the women who died in his ward before 1847 are mostly not remembered at all. They were right about the doctors, too. They said something was wrong. Nobody listened. The safest place to give birth in 1850 was anywhere a doctor wasn't. The question worth sitting with is not whether that could happen again. It's whether it already is. If this story hit you the way it hit me, drop a comment below. Tell me, do you think something like this is still happening today? I read every comment. If you want more stories like this, the forgotten truths behind medicine, the mistakes that cost lives, and the people who tried to change them, hit subscribe and turn on notifications. We're just getting started opening this jar.